Hi, everyone. This is Heather Carter.
And I'm Dr. Shad.
So, we are here with another conversation that matters, and we're wearing masks. So, it's hashtag Mask Up Arizona. We are trying to increase the number of people wearing masks in Arizona. And so, there's a robust social media campaign on both Twitter and Instagram and Facebook. And so, I'm sporting my beautiful Arizona mask. What do you think, Dr. Shad?
It looks great. It's a beautiful design. We've got our nice Arizona flag right there.
That's right. And these masks were made by my good friend Allison's mother, Liz, and she is making them and handing them and giving them to elected officials across Arizona.
That's
So
great.
you'll see
I
these.
need I need to get one of those to show my Arizona pride.
I think I might be able to connect you with Allison to get that done. So thank you, and thank you to the Arizona Chamber of Commerce and to the sponsors that provided the material and the elastic to make these masks a reality, and to the Arizona Manufacturing Council as well. So since we are at home, we can take our masks off now.
Yes, we are at home, so it's okay. You don't have to wear the
So
mask inside the house.
I do love this mask. It's
It's
awesome.
nice.
And it's washable, and uh,
Wow.
we're trying to make sure, as you know, in Arizona, to increase the number of people wearing a mask. So
Yes.
let's just take a deep dive right into that conversation. We've talked a little bit about masks in the past in some of our conversations that matter, but right now, this is the most important conversation we can have as a state. So tell us why this is so important.
Well, it's critically important. As you know, the numbers have gone up pretty dramatically in the wrong direction. As the governor stated, we really are not out of the woods, and we need to really be humble about what's happening because the course of this virus is unpredictable. And the percentage of positive cases, the number of folks in the hospital, some of us know close friends or family members have been affected now. They're being hospitalized, they're very sick, they're in the ICU. All of these are indicators that we've had extensive community spread. And all of the most recent data and research that's out there shows the power of our behavior in terms of how we act in public to make a huge impact on whether or not we spread this. So we as individual Arizonans, have the power to stop this pandemic from getting worse right here, right now. So the key things that we can do are number one, as you said, we talked about masking up, wearing a mask. So Mask Up Arizona, hashtag mask Up Arizona. Masks are very important because they provide that physical barrier. And when in times when you're having to interact with people in public, when you're in closed spaces, even if you're in the grocery store, right, for those number of minutes, it really helps. Now, masks aren't going to save you by themselves or keep you from spreading to others if you spend over 20 or 30 minutes with someone who's infected, or if you have it and you're asymptomatic and you're sitting down inside with someone in a closed space and you're not physically distancing. So in addition to masks, we also have to do our job to do physical distancing. So it's really a matter of doing both physical distancing and mask, and the mask buys you some time to be able to go out in public and stay open. So really part of the cost of staying open and continuing to conduct business, which is really important for the economy as well as people that have and maintain their jobs, is really for us to maintain physical distance and wear masks. And then additionally, obviously washing our hands, avoiding to touch our mouth and face. But, the most recent studies have shown that if every single person who goes out in public wears a mask and keeps physical distance, you can literally overnight cut the numbers dramatically and really slow the spread. Just like within that 1 to 2 week window, which is what we see for the incubation period. So remember, don't be disheartened if we don't see a big impact tomorrow, right?
Right.
Whatever decision we make, right? If we start having more Arizonans wearing masks, really, acting the way we all should, because we can't act like everything's normal right now, right? We're not out of the woods, as the governor said. The pandemic is still very much with us, and we need to act that way. We need to act responsibly to protect ourselves and protect everyone else around us.
Right. And it really is about, just taking individual responsibility and making sure that you have some sort of a face covering. And it doesn't have to be fancy. I mean, this is what I'm seeing in some of the literature, where communities or states or countries came together and had everybody wearing a mask. And we can take individual responsibility to do this. We don't need to wait for the government to tell us to wear a mask. We can just do it ourselves. And it could be something as simple as like a ski muff that you would put around your neck and you lift up over your nose. It could be something that you get made that's really cool and designer, or something as simple as the less expensive surgical mask. I also know that we are still seeing a shortage of personal protective equipment in some of our most vulnerable settings. So our elderly at home that received homebound care, to make sure that the daily caregiver that comes into the house has a mask. We're still having some difficulty on the supply chain on some of the PPE, from gowns to face masks to gloves to sanitation material, whether it be the disinfectant sprays and the wipes and the hand sanitizer. So, take personal responsibility and think about getting some kind of a mask, that doesn't necessarily include an N95 mask that we need to reserve for those that are doing work. But I'm getting a lot of questions, so if you don't mind, I'd like to ask you another question.
Please do.
As we see our numbers increase in Arizona, the narrative has shifted from people saying, I don't know anybody that has been diagnosed with COVID, to now, just within the last week, a number of my friends and family have said, yes, this person has been tested and they are positive for COVID, family members, friends, things like that. And now people are starting to realize the dire situation we are in with our numbers increasing. And they're asking, is the virus still, do we still think it's spread by surface contaminants? Do we think it's more airborne? The difference of being inside versus outside with individuals. How about the length of time when you're with individuals? Can you just share some of the most up-to-date research on these questions?
Yeah, these are excellent questions. So what we know now is that all those factors are important. So critically important is to maintain physical distancing. As I mentioned before, the mask buys you some time, but by itself, it's not enough. So probably, let's say you have about 5 to 10 minutes of additional time with a mask to be able to, again, have those quick interactions, right? When you go into the grocery store, you're walking through getting takeout, right? But when you're actually sitting close to someone, right, less than 6 feet apart, inside, right, and you continue to do that for more than 10 minutes, the more time you spend with them, even if you're wearing a mask, the higher the risk you have of getting infected or infecting them, right? Again, we know that asymptomatic spread happens. I have a couple interviews I've had that are on my website where I talk about the asymptomatic and pre-symptomatic spread, and it does happen. It is not known exactly how often, but it is enough for us to be aware of it, so that you could be asymptomatic or pre-symptomatic and you could be spreading it. So limiting the amount of time that you spend with someone. So if I want to ideally connect with someone in person, the best way to do it is to be at a distance of at least 6 feet apart, both of you wearing masks and both of you being outside. If you're going to be inside and you're going to do that, then definitely, again, wearing masks 6 to 10 feet apart or more, but I wouldn't spend too much time inside, right, together, because that's a closed circulation. And if there is a chance that there is some data that shows that it could be aerosolized, then that if you're in the same ventilation system for a longer period of time, we know the dose response. You increase your time with exposure, you increase your chances of getting it or giving it. So both of those we have to keep in mind. Again, as I mentioned, everybody wearing best practices, wearing a mask, meeting each other outside, maintaining physical distance, shorter time frames in person rather than longer because there's a dose response, and avoiding indoors for long periods of time unless you're able to really keep significant distance and wear masks. And again, the more time you spend in close contact indoors, the higher the risk of getting it or spreading it.
So that's great advice. And now, as the reports and testing has increased and the number of people that have been identified to be active in an active diagnosis of COVID-19, I'm getting a lot of questions on what is the incubation period. So you start having your symptoms, let's say on a Wednesday, and you were with that person on Monday. Do you think that the person was asymptomatic on Monday and now you are exposed? Or do we know that there's a good 48-hour period of time before the symptoms show? Taking aside people who are just asymptomatic 100% of the time. People have a symptom, they've been tested, they have been tested as a positive case. What do you think that window is prior to the symptoms, where if you were interacting with that individual, you probably are either okay or you probably should take extra care?
Yeah, unfortunately, the answer is that we don't know. Unfortunately, the answer is that we don't know. And so because we don't know, the best thing to do is, if you know that you've been in contact with someone who has COVID-19, is tested positive, or is having symptoms and likely has it, then if you came into contact with them during the 14-day window, which is the incubation period, then you're definitely still at risk for getting it, because there have been studies where they found people who are completely asymptomatic as well as pre-symptomatic, and they have the same amount of the virus in their system as someone who's full-blown symptomatic.
Wow.
And we know from other viruses and viral infections that the amount of viral load, as we call it, in your system also is an indicator of when you're most infectious. And so the fact that someone who's completely asymptomatic can have the same amount of viral load as someone who's totally symptomatic and having a lot of symptoms, that tells us that there is a lot of significant in asymptomatic spread. So we don't know what percentage. The studies vary between 30 to 40%. We don't know exactly what it is, but the point is it could be happening. So the best is, if you've been exposed, or you think you've been exposed, or you've been exposed to someone who has COVID, you self-isolate yourself and quarantine and do the best you can to optimize your health, right? If you haven't been drinking enough water, drink enough water, avoid excess alcohol or caffeine, eat more fruits and vegetables, make sure to get adequate sleep, right? These are all things that you can do to boost your immunity and be able to fight off the infection if you end up being one of those who is ultimately infected with COVID-19.
And that's great advice as we bring this conversation to a close, because we started this series, Conversations That Matter, around making healthy life choices for you as an individual. And now it's become even more important to make sure that you're making a healthy choice on a regular basis, because as we open up the economy safely, and hopefully with masks, using social distancing, and surface disinfectants and appropriate hand washing, that doesn't mean the virus will just magically disappear.
No.
To maximize your defense against this horrible virus is to take a lot of personal responsibility around your hand washing, mask wearing, social distancing, eating, sleeping, and drinking water.
Yeah, the more we optimize our health, right? So the healthier we are going into it, the better off we are on the other side of it. And we'll talk in future conversations more about why folks with chronic diseases and chronic conditions are at higher risk. And we'll go more specifically into the different conditions like diabetes, prediabetes, high blood pressure, heart disease, high cholesterol, being overweight or obese, And, these are some of the reasons why, maybe many folks in the US, because we have a lot of these chronic diseases, unfortunately, we're more susceptible for getting sicker with COVID-19 infections. And this may explain some of the reasons why we have such high numbers here. So it's an opportunity because those diseases existed before COVID-19, right? Heart disease, diabetes, and cancer have been known to account for the majority of deaths as well as healthcare expenditures, and most people in the United States either have or know somebody who has one of these chronic conditions, right? Or is pre-diabetic, right? Or overweight, moving towards obese, or one of those things. So we know that if you're sick in those ways or have those risk factors, you're more susceptible to getting really sick with something like COVID-19. So there's no better time than now to invest in your health and optimizing it in any way you can. And we'll talk more about how you can do that, practically speaking, with the decisions that we make in terms of what we eat and how active we are every day.
Well, I think that's a great summary statement for our conversation today, because at this point in time, I think it's important to really highlight the need for wearing a mask and following social distancing and the hand sanitation and the surface sanitation like we talked about. But to give that tease of stay tuned. We've already had initial conversations about the chronic disease state of the United States. And what we'll do over a series of the next few weeks is really look at each one individually and how that is playing out in the COVID-19 situation. And then tips for you to take action. We started our conversation by saying, eat more broccoli. So I'll end here today, just for today, eat more broccoli, drink more water. Fruits and vegetables are your friend, and they can hopefully provide you with the path to maintain your health so that you can fight off any type of infection should you be exposed. So.
Yeah, that's great. And broccoli, again, as we mentioned before, has quercetin, which is one of the nutrients that's been shown to block the receptor site that COVID-19 binds to in your cells to get into your cells and make you sick. So it definitely boosts your immunity and has a direct connection to helping to prevent you from getting really sick from COVID-19. So more fruits and vegetables, better off you are. But if you don't physically distance, if you don't wear masks, you're not giving everybody, including yourself, the best chance in terms of fighting off this virus.
Right. So that's a shout out to broccoli, and take some individual personal responsibility, and let's do all we can to help each other during this pandemic. So thank you, Dr. Shad, for your time today. We'll be posting this on our social media channels. And as always, if you would subscribe to our social media channels and to the YouTube videos, you'll be able to stay up to date with all of our conversations.
That's right. We'll see you soon.
Thank you.
Thank you. Bye.